Our next testimony will come from Ray Kelley, Veterans of Foreign Wars Legislative Director. Mr. Kelley is charged in that position of making sure our nation provides veterans with the highest quality care and services possible. Formerly a National Legislative Director of AMVETS, Mr. Kelley's credentials as an advocate for America's veterans have been well established. He served 6 years in the U.S. Marine Corps, achieved his Bachelor of Science in Political Science at Indiana University, and served 3 years in the Army Reserve, where he conducted over 250 combat missions in support of Operation Iraqi Freedom. Thank you, Mr. Kelley.
Thank you. Thank you. Thank you for the opportunity to testify before you today. While the VFW has a comprehensive list of policy positions, due to time constraints, I will limit my remarks to just 3. The VFW is concerned with the human side of foreign policy. When diplomacy fails or terrorists attack, it falls on the shoulder of the few who have volunteered to do the dirty work our government asks them to do. And unfortunately, during economically hard times, these same few feel the immediate impact of budget cuts. Sequestration and arbitrary budget caps disproportionately hit service members and veterans. To ensure they do not exceed their budget caps, Congress and DOD have made immediate cuts to personnel costs, troop reductions, below CPI pay raises, asking service members and retirees to pay more for their health care, and the threats of removing other quality of life benefits like on-base child care and commissaries continue to impact readiness and morale. For veterans, the situation isn't any different. While VA is protected from sequestration through fiscal year 17, it still must live within budget caps, regardless of the actual need for funding. Today, there are more than 15 legislative needs sitting on Capitol Hill that will increase the access and quality of health care for veterans, improve the disability claims system, expand access to care for female veterans, and provide caregiver benefits to all generations of benefits, and the list goes on and on. My point is, most people believe since VA is currently protected from sequestration, veterans are being taken care of. That is not necessarily the case. The VFW calls for the end of sequestration and developing a rational approach to establishing budget limits that allow Congress to budget to need as opposed to caps so VA can be fully funded. The VFW opposes the privatization of VA healthcare. That does not mean we accept the status quo. The VFW is working with VA and Congress to advance several initiatives to improve timeliness and quality of care for veterans. First, VA must be the first touch point for all veterans so their care can be coordinated and guaranteed. We realize, though, that VA cannot provide all care to all veterans at all times. That's why we recommend developing a network of non-VA providers who are integrated with VA, so access to care can be provided when veterans need it and in the most convenient means possible. The arbitrary 30-day wait times and 40-mile distant requirement must be removed. Decisions on when and where a veteran receives their health care should be determined between the healthcare provider and that veteran. VFW is also concerned that the disability claims and appeals process, VA has made great strides in reducing the claims backlog, but it comes at the expense of the appeals process. Today, more than 450,000 veterans are waiting for answers from VA on the status of their appeal. The VFW continues to work with both VA and Congress to improve the process, while the VFW supports current legislation, HR 5083. There are areas that have not been adequately addressed. Thank you for this opportunity to speak before you today, and I look forward to any questions you have.
Thank you very much. Are there any questions? Yeah, Paul.
Could you comment on the extent to which the you talk about ending sequestration and setting budgets on a basis that's related to the needs. The needs have been impacted by the larger number of veterans coming home from recent conflicts, by the different geographical decisions that they make when they come home. They don't necessarily move to the same places where VA hospitals always were. So you have parts of the country with many more veterans than hospital beds would indicate. If we end sequestration, which I am totally in favor of, give us some guidelines for the additional or different resources that the Department of Veterans Affairs needs in order to serve the larger number of people who are entitled to the support of the American people.
Sure. Currently, the administration's request for just delivery of health care, that's within VA and outside non-VA care, is $1.5 billion more than what the House appropriations budget calls for. That is a budget cap issue. Also, the VFW is very interested in VA infrastructure, the hospital infrastructure. And VA is $60 billion behind. They have a 10-year plan to get themselves out of an infrastructure problem. There's $60 billion in the next decade that it would take to get them out of that. I don't think they're going to do that. We recommend that some public-private partnerships, some sharing agreements between the public and private sector and public sector to provide that care to veterans would help a lot. But infrastructure needs to be funded as well, probably about another $1 billion more a year until that's taken care of.
Before I leave you, your willingness to accept public-private partnerships, et cetera, doesn't it have to also be subordinated to a principle that you originally stated, which is that the VA itself has to be the coordinator of care?
Right. Yeah, I agree. So even in a public-private partnership, that could be a VA facility. In the other aspect of that, which is VA being that first touch point, in our vision, private doctors, non-VA doctors would be networked and they would be integrated with VA. So VA has quality assurance of that health care, and those records come back to VA. So if there needs to be follow-on care, something else that needs to be seen, or some other conditions that need to be taken care of, VA will recognize that and be able to help take care of that.
Thank you.
Thank you. Any other questions? We will now.
Thank you.
Testimony.
Thank you.